So I have an order for medication for Ferdinand Foley. I'm going to perform hand hygiene. And I'm going to check his MAR. All right. Ferdinand Foley, September 23rd, 1969, has no known allergies, and he is due for a Humulin R 8 units subcutaneously now. Okay, so I'm going to make sure I have the right medication. I do have Humulin R, and this is for Ferdinand Foley, September 23rd, 1969, no known allergies. Humulin R 8 units subcutaneously, sub-Q now. And this medication is not expired. All right, so now that I have my medication out of the drawer, let's set that to the side because I don't need that. All right. Now I'm going to perform my second check. After I get my equipment out, I'm going to need the proper insulin syringe, some alcohol swabs, and a gauze. All right, and a barcode scanner. I'll close the drawer, and I'm going to make sure that I have everything again. So this medication is for Ferdinand Foley, September 23rd, 1969, no known allergies. The medication is Humulin R, and he's receiving 8 units sub-Q now, and the Humulin R is not expired. All right, now that I've checked that again to make sure that I have the right medication and it is not expired, I'm going to prepare the medication. And Mr. Foley is getting 8 units of Humulin R. I'm going to clean the top of the Humulin R with an alcohol swab for 10 swipes across there. And while that's drying, I'm going to open my insulin needle. This is the proper insulin needle. All right, I'm going to dispose of that. And again, he's getting 8 units. So to give him 8 units, I will need to draw 8 units of air into the syringe. All right, so I have 8 units of air inside of the syringe. I'm going to remove the cap from the syringe and insert this 8 units of air into the Humulin R bottle without touching the outside of the lid or the medication on the inside. So I've inserted 8 units. I'm going to invert the bottle, and now I'm going to draw 8 units of Humulin R into the syringe. And I'm going to ensure that there is no air bubbles. And I'm going to remove the needle and put the cap on the needle using the swipe with one hand method. All right. I'm going to verify with another nurse that that is 8 units. Okay, now that I have 8 units, I'm going to verify that one more time. That is 8 units. So I have 8 units of Humulin R for Ferdinand Foley, September 23rd, 1969. He has no known allergies. He's receiving 8 units subcutaneously now. Okay. Humulin R. Okay, so I verified the Humulin R to the MAR. I verified that there's 8 units of Humulin R inside of the syringe. Now I'm going to label my syringe. label the syringe, I'm going to label it with the Humulin R, which is the medication. 8 units is the dosage. And it is 0600 March the 11th, 2026. And my initials are H. I'm going to place the label on the syringe that has 8 units of Humulin R. All right, so Mr. Foley will be receiving 8 units of Humulin R. Mr. Foley, September 23rd, 1969. Humulin R, 8 units. I'm gonna go ahead and put this Humulin R back into the drawer. Okay. Now that I have everything, the medication's in the drawer, I'm gonna do one more safety check just to make sure that I covered everything for Mr. Foley's safety. His MAR reads Ferdinand Foley, September 23rd, no known allergies. Humulin R, 8 units subcutaneously now is 0600. And I'm going to go ahead and sign and initial the MAR. All right. Okay. Now that everything is signed, initialed, I'm letting them know that I will be going ahead and administering Mr. Foley's insulin injection. So I'm gonna take all of his equipment to his room. Knock, knock, knock. I'm Rebecca. I'll be your student nurse today. I'm going to perform hand hygiene. And I'm going to verify the patient. Okay. All right. So I've already introduced myself. I'm going to go ahead and lift the bed. All right. So today I'm here to give you an insulin injection, Humulin R. I'm going to go ahead and check your name and date of birth. Can you tell me your name and date of birth? All right. Ferdinand Foley, September 23rd, 1969. Ferdinand Foley, September 23rd, 1969. And that does match the MAR. All right. So I've matched my MAR to my patient. So now that I've matched my MAR, I'm going to go ahead and scan his wristband and verify. I'm going to scan his medication and verify, and it is the right medication for the right person, right patient. All right, Mr. Foley, so we have Humulin R. We have 8 units subcutaneously for your injection today. And are you in any, can you rate your pain today on a scale of 0 to 10? All right, 0. Do you have any allergies that I don't know about? All right, so patient says he doesn't have any allergies. Patient says he doesn't have any pain. All right, so I'm gonna go ahead and put my gloves on. All right, Mr. Foley, so for subcutaneous injection, you can receive it in several locations. You can receive it in the backs of your arms, the outer arms. You can receive it in your scapular area, between your shoulder blades, avoiding any bony prominences back there. You can also get it in your anterior thigh or your ventral gluteal area, which is your upper buttocks area, or you can get it in your abdomen, 2 inches away from your umbilicus. All right, Mr. Foley, so you said that you would prefer it in your abdomen. All right, since we're going to go to the abdomen, I'm going to go ahead and inspect that abdomen area. Lifting the shirt. Okay, I don't see any bruising, any signs of scarring or anything, so it does look like the proper site to receive an injection. All right. Okay. Verify again that this is 8 units of Humulin R. All right, Mr. Foley. So before I start, I'm gonna prep the site by cleaning it. I'm gonna go ahead and open the gauze, have that ready for any bleeding after the injection. All right, so prepping the site. I'm gonna wipe from the center to the outer in a circular motion, 1 to 2 inches. I'm gonna allow that to dry. And probably as that dries, I'm gonna go ahead and prepare to inject. I'm gonna pull the lid off straight up. And I'm going to, Mr. Foley is a heavier guy. So with adequate adipose tissue, so I'm going to pinch the site, and I'm going to for video purposes, I'm going to take the insulin out, and I'm going to drop 8 units of air. All right, so now I'm going to proceed. I have 8 units of air. Okay, so I'm gonna prep the site. I'm gonna pinch the site. I'm going to insert the needle quickly and release. And then I'm gonna inject the medication slowly. Okay, once all the medication is inserted, I'm gonna hold the needle in for 10 seconds, 1, 2, 10, and release. I'm gonna put the safety up. And dab any blood without putting any heavy pressure on it. I don't want to cause any scar tissue. All right, Mr. Foley, is that any pain? All right, Mr. Foley says he doesn't have any pain. I'm going to get you covered back up. I'm going to educate Mr. Foley on the signs and symptoms of hypoglycemia, lightheadedness, hunger, dizziness, confusion, change of his level of consciousness. And this will go in the sharps container inside the patient's room. I'm gonna place the patient back in his bed, back in the low position. Patient at this time doesn't have any pain. He's educated on the signs of hypoglycemia. Bed is in the low lock position. Both handrails are up. The patient does have his call light in his hand. And let's say I will put this in the sharps container and dispose of all equipment. All right. I'll put this, I'll perform hand hygiene. And go ahead and annotate this on my MAR that we did inject Mr. Ferdinand Foley with his Humulin R, 8 units subcutaneous. We did it in the abdominal at 3 o'clock. Location on the abdomen, 2 inches away from the umbilicus, and we gave him this at 0600. I'm gonna write in 0600, and I'm going to write my initials to let them know that he did receive the medication. And I'm going to perform hand hygiene, and I will let Mr. Foley know to contact me if he needs anything. And I'm done.